Anxiety medicines may cause neurological problems. Despite the fact that benzodiazepines have been widely prescribed for decades, this survey presents significant new evidence that a subset of patients experience long-term neurological complications, lead author Alexis Ritvo, MD, MPH, an associate professor of addiction psychiatry at University of Colorado Medicine, said in a statement. This should change how we think about benzodiazepines and how they are prescribed. The study found that more than 40% of people who use benzodiazepines go on to experience more than 17 different neurological symptoms that can last for longer than a year. They were usually different than the initial reason for which the people were prescribed the drugs in the first place. Researchers said the duration of the new problems indicated the new issues were more than merely signs of withdrawal. Survey respondents said the initial reasons they were prescribed benzodiazepines were situational anxiety, 44%, insomnia, 40%, panic attacks, 40%, depression, 33%, and generalized anxiety disorder, 24%. The new symptoms reported included low energy, difficulty focusing, memory loss, anxiety and nervousness, sleep problems, light and sound sensitivity, digestive problems, muscle weakness, or body aches. Of the people reporting those symptoms, at least half of them said the problems lasted more than 1 year. More than 40% of the people who had one or more of those symptoms said the new issues significantly affected their marriage or other relationships, contributed to suicidal thoughts or attempted suicide, contributed to job loss, being fired, or becoming unable to work, resulted in increased medical costs. The authors wrote that the term withdrawal is not helpful when studying and treating these symptoms, and their impact on people's lives. They suggested that a new term may be more appropriate. They proposed benzodiazepine-induced neurological dysfunction, or BIND. Recognizing this condition with a specific medically accepted term may encourage more professional compassion, better treatment, and future research, researchers wrote. Any medical condition with many vague or overlapping names or without a name can too easily be misdiagnosed or dismissed as insignificant or non-existent. The study had significant limitations, the authors noted. The respondents self-selected and mainly came from support groups. Researchers were unable to collect independent psychiatric diagnoses. But because their findings align with those of previous small studies as well as extensive anecdotal reports, further action is needed, they wrote. Since benzodiazepines are among the most frequently prescribed drugs in the United States, treatments for BIND represent an urgent unmet medical need, they concluded. This warrants greater and more in-depth research.